This is what a harm reduction kit for the city of San Francisco looks like. Last week, the city told nonprofits that if they wanted to continue distributing things like this to drug users, they must also offer counseling and information on treatment. Those that don't comply will lose city funding.
So, how's it going so far? ABC 7 News Building a Better Bay Area reporter Leanne Melendez is here to tell us more demands to come.
Yeah, so the newest demand is that as of May 30th, nonprofits cannot distribute smoking supplies in public spaces. Now, with regard to Narcan or syringes, if you want these items, they will come with a talk and information about treatment. Now, Mayor Lurie is pushing for more treatment. We know that after looking at the number of people dying from overdoses, and he said, quote, "We cannot accept the reality of 2 people dying a day from overdoses."
There was a time when drug use supplies and smoking kits were handed out freely on San Francisco city streets. No strings attached. It's hard to argue that those were the good old days. We first brought it to your attention in October 2023.
You got one of those things you can put the needles in?
Yeah, we do. We got these fancy boys here too. You got the last one.
Oh, what about the little black ones? Cause that's
you prefer the little black ones too. The pencil boxes, I call them.
Yeah.
Those are nice, right?
Right.
Do you need anything else?
No, that'll be all.
Okay.
Oh yeah, one more thing.
What's up?
What about y'all got any pamphlets on detox or treatment?
I don't have any pamphlets on that.
The thing they put the needles in. Gotcha. But you got any pamphlets if somebody wants rehab or something?
We don't have any paperwork.
Okay. All right. Thank you.
Right on. Take care.
Meanwhile, the data cannot be ignored. Unintentional overdose deaths in San Francisco have continued. Since January 2020 to March 2025, 3,524 people have died. Now, under Mayor Daniel Lurie, these supplies, things like syringes and Narcan, can no longer be distributed without counseling and connections to treatment. The city says it has provided extra funding to nonprofits to hire skilled staff.
When you see it working, it's incredible. When you don't have the right trained skill set and you're just throwing things at someone and barking things, that does not work either.
So a few days after the new policy was implemented, we set out to see if these nonprofits were complying. Glide had indeed several informational treatment brochures in their mobile carts, but none on their folding tables until we asked them to place them there. We then asked clients if Glide was offering counseling or a way for them to connect to treatment.
They have brochures as you walk up, and they offer you, they say we can help you if you ask.
Have you ever accepted their help?
Not theirs, but yes, I have gotten help.
At this San Francisco AIDS Foundation mobile site in the Bayview, the brochures were there but kept to one side and not prominently displayed. And more changes are coming from the health department. As of May 30th, these mobile sites will not be allowed to offer any smoking supplies in a public space. Items such as pipes and aluminum foil used as a surface to smoke drugs like fentanyl.
We are requiring by May 30th that all of that come indoors, out of public spaces.
I've been out here since I was 18.
Back in the Tenderloin, we met Liz Mahoney, now 34 years old, who said she too has been offered help.
Have they ever said to you, you know, there's treatment to quit using drugs?
Yeah, absolutely.
So how do they say it?
If you ever need someone to talk to, if you ever need resources, just come talk to us and we'll let you know what there is available.
But it's not as black and white as people would like it to be. Mahoney has a dog, so she refuses to go into a drug treatment facility. She's tried outpatient programs, but until now, they have not worked.
What keeps people away from treatment?
The withdrawals are really severe.
What do you use?
I use fentanyl and meth.
While it's difficult to get people off drugs, nonetheless, the city recently partnered with the Salvation Army to secure 21 additional drug treatment beds at their residential facility south of Market called Harbor Light. The city also opened a crisis stability unit on Geary Street, but it's far from enough.
One of the things that people say is that we don't have enough treatment beds. So what is being done there?
And they're absolutely right about that. And the issue sometimes is the proactivity Do we have the right skilled people able to engage with and chat with someone? And do we have treatment actually readily available instead of saying, you know, come tomorrow morning at 9:30 to this place and maybe there will be treatment. That is not going to help anybody. We're trying to get much more immediate and urgent about meeting people where they're at and helping them get quickly connected that moment into treatment and services.
And Sy says this new approach won't be easy. We know that. The city doesn't have enough treatment beds, though. But Lurie feels he has to take that approach because, in his words, what we had before wasn't working. Now, nonprofits like the AIDS Foundation fear that some will move from smoking drugs to injecting them. And one of the reasons why I did this story also is because the pipe, sometimes if you don't have a clean pipe, you go to your neighbor and say, could I use your pipe, which has been used with fentanyl. And sometimes there's residue.
Right.
You add more
Very
fentanyl,
dangerous.
it's very dangerous, correct.
Yeah.
Yeah.
Oh, goodness.
Boy, you know, what has been done wasn't really working. Most people
Right,
have to agree
right,
on that. We'll
wasn't.
see if this makes a difference.
Us see.
Okay.
Give
Thanks,
it
Leanne.
6 months.
Yep.